you for inviting me for this talk because I really enjoy giving preventive oncology talks. So, since we all know that October we observe as a breast cancer awareness month, so this is our initiative for all the ladies of our country to educate them regarding breast cancer. So I will be dividing my talk in few steps. First, I'll be talking what is breast cancer. Second, I'll be talking what are the dreaded effects of breast cancer that can happen, including the age incidences. Then I'll be talking about the screening part, that how can we screen and how the community can help us detect the breast cancer at an early stage, uh, where we can treat them and cure the patients. And last, we'll have, I'll talk a little bit about the treatment modalities available for treatment of breast cancer. And then we'll have a question answer session. Hopefully, I should not take a long time. So I'll start. So, you know, we all know that cancer is something which is life-threatening, and people who get detected with cancer, and the first response is that my life is gone. But that's not so. So cancer is something where uh, you know uh, each cell or any cell of our body that outgrows the stipulated number of time that it is programmed to do that. Like we know, we all work with mobile phones, laptops, wherein we use softwares, and we know softwares, they have a specific program and they are capable of doing a particular event. But same is true with our human body. So when the software program of our cells, especially today I'll talk of breast cancer cells, goes haywire or it gets tagged with a virus, so what happens? The cells outgrows and they do not stop multiplying, and they grow, and then they go outside the breast. They go to your bones, they go to the liver, they go to lungs, brains, and they damage the functioning of all organs. So any cancer arising from the breast tissue is known as a breast cancer. Now, why breast cancer early detection is very important. Before I go into the technicalities of detecting early breast cancer, I just like to share some of my feelings. That what I feel is that if you educate a male, you educate an individual. But if you educate a female, you educate a whole family. So that is the importance of women in our society. So if you want an educated society or educated family, please protect women. And that's why we need to prevent breast cancer and treat them at the earliest. 99% of breast cancers happen in women, and only 1% of breast cancers happen in males. So that's why women are more important. So, what happens with breast cancer if you do not detect it early or on time? A small breast cancer, say if it is just maybe zero point 0.5 centimeters or 1 centimeters, get treated and cured simply by a surgery, and does not require dreaded chemotherapy or immunotherapy, which has plenty of side effects. And you can be sure the incidence or the chances of cure ranges in approximately 90%. Only 5 to 10% patients fail if they are detected in stage 1 breast cancer. Similarly, on the other side, if your breast cancer goes to stage 3 or 4, your cure rates drastically drop to 10 to 15% or 20%, and which is really bothersome for us because time is the most important factor. Now, if you just ignore a breast lump, then it may present with a stage 4 breast cancer, and you may come to our OPD with a disease which is incurable. Now, coming to the screening part, how to detect a breast cancer which is early and uh, wherein we can cure it with very effective and very little treatment. The best thing that we can do is teaching you self breast examination. That is the most important part in detecting breast cancer early, because as a lady, while having a bath or while wearing clothes, you invariably look at your breasts every day and you know what is the size, texture, and shape of your breast. So, any abnormality that you notice in your breast can be picked up by you, and please report it to an oncologist so that if at all there is something wrong, they can pick it up early. Coming to certain signs of breast cancer is mostly present with a lump in the breast, which invariably grows with time. Now, how do you know that there are other lumps also in the breast, like fibroadenomas and fibrocystic disease, which are benign? So, how do you know that which lump is cancerous or which is no? A crude way of knowing it: just keep a peanut below the quilt and try to feel it on from the top. You will feel a very hardish, stony hard lump. So these are the kind of lumps which can be cancerous. Then the other signs are dimples. Dimples on the cheeks are definitely beautiful, but not on the breast. So if you have dimples on the breast, that is one of the signs of breast cancer. Any kind of a discharge from the nipple other than milk can be a sign of breast cancer, especially blood. If you are having a bloody discharge or a whitish discharge or a blackish discharge, greenish discharge, all these could be signs of breast cancer. So this needs to be evaluated uh, properly. Then coming to the skin texture, you all have seen orange peels, the orange skin. So if your skin feels like an orange peel, which is known as a pure orange appearance, so that is also a sign of breast cancer. Many a times there might not be a lump which is felt in the breast, but you may feel a lump in your armpit. So that is where the breast cancer goes for the first time. That is the lymph nodes in the axilla. So if you feel any axillary lump or axillary node, please get your breast checked. So that is the first step. That is the self breast examination. And what I would suggest is that go to Google, go to the images, type self breast examination. There are at least thousands of protocols available and thousands of charts available for self breast examination. So you pick any one of them, stick it on your mirror, follow it at least once in a month for 10 minutes. And that gives you how to examine your breast. Basically, you need to examine your breast with your four fingers, with a whole hand, and right from your clavicle, that is your collarbone, till the ribs, and from your chest bone, that is the sternum, till your midline of the armpit. So that is the extent of breast. And if you feel any kind of a lump or any abnormality, then please report it to an oncologist for confirmation. So that is first step of self breast examination. Coming to clinical breast examination, for which you need to come to the hospital, come to an oncologist, and it should be done once in a year. So what you do every month for 10 minutes, the same thing is done by the expert hands, uh, by the oncologist, and that should be done once every year. So you can pick up breast cancers at an early stage. Next, come to the modalities. We go in for like mammography, which I'm sure most of you must have heard. So mammography, there are of two types. One is a sonomammography, wherein we use ultrasound as a modality for detecting breast cancer, and the other is conventional radiological mammography, wherein we use X-rays. So mammography, the in thing is that in the Western world they prescribe almost 40 mammographies for in a lifetime of a woman, which I feel is not a suitable protocol for our Indian population. Because in the Western world, 1 out of 3 women has breast cancer, whereas in the Indian population, 1 out of every 8 women develop breast cancer. So we cannot follow the protocols of the West blindly. So what I do for a practical purpose is that I divide every patient into 3 categories. That is standard risk, intermediate risk, and high risk. High risk patients are the ones who have at least 3 generations having breast cancer, like their mother, mother's sister, their own sister or their grandmother from the mother's side. If they have breast cancer, you fall into a high risk category and you need screening at least 10 years before the index case in the family. For example, if your mother was diagnosed of breast cancer at the age of 40, then you should start screening at the age of 30. So this is the importance of where we divide. And intermediate risk is when you have just one immediate family with breast cancer, and standard risk that you have no risk or no family history of breast cancer or ovarian cancer, that you fall in the standard risk. So for standard risk patients, we start screening at the age of 40. For intermediate risk, as I said, it's 10 years before these index case in the family. And then depending on your risk, we advise clinical breast examination every year, mammography at least till the age of 50 for standard risk people. I advise once every 5 years. And for high risk patients, I advise once a year, that is after the clinical breast examination and discussion with your oncologist. The other things that we use for screening breast cancer is an MRI. MRI is a very highly sensitive modality for detecting small breast cancers. Like there are tumors which, even the expert hands would fail to detect clinically. And on mammography, you have a very small or a high suspicion that, but you cannot detect it. So in those cases, we subject you to MRI. The other population whom we subject to MRI screening is younger population. Around 0.065% breast cancers happen in the age group of 20 to 30%, 30 years of age group. So who have a high risk. Now, such population, if you try to screen with a mammography, probably with dense breast, you will not find anything. So these are the kind of population where we subject them to MRI. So that is what do. And whenever we find any suspicious lump, which gives you a very high suspicion clinically and by mammography or by ultrasound, we put a needle in it and we do an FNAC or a biopsy from that lesion, and we try to prove whether it is cancerous or not. And the pathologist, they are expert in diagnosing cancer slides. So they help us in detecting this cancer and labeling it that this is the cancer that we have. Now, briefly about the treatment modalities that we have for breast cancer. For a small lump, which is less than 2 centimeters in size and has a good biology, we invariably go in for surgery upfront. And at times, depending on the biology of the tumor, surgery itself is curable and patient may require radiotherapy along with it. Like suppose if we are going in for a breast conservation, then yes, surgery followed by radiotherapy is the standard line of care, plus minus chemotherapy or immunotherapy or hormone therapy. That sorry for the interruption. So we were talking about the modalities for treatment. So I was talking that if there is a bigger tumor which cannot be operated upfront, so we give neoadjuvant chemotherapy. That means we give some kind of a systemic treatment to downstage the tumor. Downstage means to reduce the size of the tumor and make it more amenable for surgery for the surgeon. So, and then after this, we again consider for hormone therapy or chemotherapy after surgery. So that is one modality. Now, in case if the tumor has gone beyond the breast and it has become a stage 4 disease, where it has gone to your liver, bones, or lung, in this situation, the cure rates are very low, only in certain category of patients, especially who are hormone receptor positives. Hormone receptor means we know in women there are two hormones, estrogen and progesterone. So if your breast is expressing estrogen and progesterone receptors, So then in these cases, you have a very good chance because in these cases, you may not require chemotherapy and only hormone therapy can cure and give you a long-term remission. Now, in this situation, in stage 4, suppose you have less than 3 sites of metastasis, matlab that your tumor has spread only to 3 or less than 3 sites. There is one lesion in the bone, one small in the lung, one maybe in the liver, or all 3 in the bones. So, like this, that you have only 3 more lesions outside the breast. In these situations, also, we treat the patients with an intent of cure. So that is the modalities that we have. The last, if the patient is not fit, he's got multiple, he has got multiple metastasis in the liver, lung, bones. In these situations, we just consider them for a palliative care or a comfort care kind of a treatment. So that is what we have. But if I consider 1996 when I joined my training in oncology, and today in 2024, the cure rates and the lifespan in breast cancer patients have gone leaps and bounces. So earlier, even with stage 1, 2 patients, breast cancer patients, we used to cure only roughly around 10 to 20%, 30% of the patients. But today, almost 90% of the breast cancer patients who are in stage 1 and 2, we are able to cure them successfully, right? So with this, I would stop talking here and expect some questions coming in from the crowd. So any questions, because we can discuss that better. I think so. I got the first question. Let me just see. Yeah, there is a question by Mr. Arvind GA. What is the ideal recovery process for a breast cancer survivor after lumpectomy, chemotherapy, and radiation therapies? How long does it take to be back to regular lifestyle, whether the chemotherapy, radiation, hormone therapies increase the severity of any kind of a pre-existing issues like urinary infection, bone weakness, etc.? Very good question. That's a very practical question. I guess somebody who must be going through this treatment. See, what is the ideal recovery process? The ideal recovery process is that once you complete your chemotherapy, and if you are hormone receptor positive, you continue on hormone therapy for almost 7 to 10 years. So this is a situation from chemotherapy, you take approximately 3 to 6 months to recover. And some patients may take even longer, may take 9 months to a year to recover. But trust me, none of the side effects of chemotherapy, they persist whole of their life. So most of them, they recover, but some may take more time to recover. And the longest time taken to recover is by the neuropathies. That is, you have tingling numbness in your hands and feet. So that takes the longest to recover. Your fatigue, your muscle weakness, all these things take approximately 3 to 6 months, depending upon your physical activity apart from your diet. So that is a very important factor for your cancer recovery. Now coming to your bone weakness. Bone weakness happens because of osteoporosis and osteopenia, which happens secondary to your hormone therapy, like if we give aromatase inhibitors like letrozole or arimidex. So these are the two drugs which induce bony weaknesses. And for them, we do an yearly bone mineral densitometry, and at times use injections like denosumab or zoledronic acid once every 6 months to prevent your bony weaknesses. And suppose if your bones are already weak before starting hormone therapy, then we switch to other hormone therapies like tamoxifen or other things in such kind of cases. Now, whether chemoradiation hormone therapies increase the severity of, yes, especially if urinary tract infection, because it brings down your immunity. So UTI should be very meticulously handled in patients who have received chemotherapy, because invariably the recurrence rates with UTI are slightly higher in women as compared to males, and especially females who are undergoing chemotherapy. So they need to drink plenty of water, flush out the system well, and the antibiotic courses are the protocols for antibiotics and urinary tract infections are different from people who are taking chemotherapy. For that, you need to consult your treating oncologist. They should do cultures of the urine regularly and guide you about how to prevent urinary tract infection by using safe toilets, not to use public toilets or use a P-safe or cleaning modalities for before you use a toilet. So all these things should be considered while you are recovering. And most important, while recovering from breast cancer treatment, is you need to have someone who is trained in rehabilitation. Unfortunately, in India, we do not have a protocol of involving a psychologist or a rehabilitation physiotherapist because patients normally do not want this, but they are the ones who play very active role as far as the rehabilitation from a cancer treatment is concerned. So there is another question I have from Mr. Ankush Gupta. Want to know full cure for breast cancer? Oh, see, that's a very long question to know the full cure for breast cancer because, as I said, early detection is a full cure. You can just go away with surgery and radiotherapy if your breast lump is small. So if you want to know the full cure of breast cancer, detect it early and go in for a screening protocol as early as possible. Shipra Mishra, there is a question. I have got a small black color boil on my right breast at the bottom. Should I be getting it checked? See, these are moles on your breast, and very unlikely that these moles would convert into a breast cancer. But yes, these moles, if they grow in size, they become itchy, they give you a wet look. So they can definitely convert into a melanoma, which is a kind of a cancer of the pigment material in our skin. So, and yes, I mentioned this in my answer itself. Your last question is, can it be a potential cancer causing lump? No. Melanomas or moles are not a cancer causing lump. They are in the skin, they are not in your breast ducts. So definitely there are certain breast diseases, benign breast diseases, which can give rise to breast cancer, but not this. How to prevent breast cancer and how often does breast cancer return? Uh, and want to know in detail about how to identify the initial stage of breast cancer. See, if you heard my presentation right from the beginning, I gave you certain signs and symptoms of breast cancer like a breast lump, dimpling of breast, the orange or the orange-like appearance of your skin of the cancer, and nipple discharge or a lump in your armpit. So this is one thing, and self breast examination, clinical breast examination, and mammography. They are one of the best modalities to detect cancer early. So that is one thing that you need to do. And the initial stage to diagnose breast cancer is self breast examination and clinical breast examination. What are the early warning signs and symptoms of breast cancer, and when should I seek medical attention? See, the early warning signs of a breast cancer, number one, at times is the lump. The commonest presentation of a breast cancer is a presence of a lump in the breast. So any kind of a lump that you feel is not, was not present earlier, but you suddenly feel and it is growing with time can be breast cancer. Now, most important thing about the lumps in the breast is, the painful lumps invariably do not turn into cancers, or they are not cancers. They are mostly abscesses or galactoceles. A painless lump which is not bothering you and which is not catching your attention is sometimes because cancers are very smart. They don't want to be detected early. So they grow without making any noise. And only their success when they get spread all over the body, they make too much of noise. So you need to detect this lump, then any discharge in from the nipple, a bloody discharge or a blackish discharge from the nipple should be considered with caution. Which age group is more prone to get cancer? See, any age group above the age of 20, being a woman, is a risk for developing breast cancer. So, as I mentioned in my talk, that if you are a standard risk, intermediate risk, or high risk, so accordingly, you should schedule yourself for screening for breast cancer. Manish Kumar had asked a question beyond BRCA1 and BRCA2. What are the small, lesser known genetic factors that can significantly increase the risk of breast cancer? Oh, that's a very important question. And these days we are doing, genetic screening as well. Other than BRCA mutations, the most important is the HRR gene, that is the homologous recombinations, HRD deficiency, or the homologous recombinant deficiency. This is, which helps in reverting back BRCA. So that is one thing. Plus, there are approximately 150 genetically transmissible mutations or genes that we look at while we do a hereditary cancer panel, which can give rise to breast cancer. Want to know the diagnostic tests for breast cancer? The diagnostic test for breast cancer is the biopsy. Biopsy is the only diagnostic test that we use as of now and which has been approved by FDA. There are trials where we are doing liquid biopsy in breast, wherein we take a blood sample and we extract the circulating tumor cells and subject it to genetic analysis, which gives you a mutation, but still biopsy you have to do from the breast lump. So Manoj had asked a question: how often should women get screened considering their age? See, I explained already in details this question, that depending which category you belong to, whether you are a standard risk, intermediate risk, or a high risk. For standard risk, I prefer screening at the age of 40. For intermediate risk and high risk, I screen patients at least 10 years below the index case in the family. Gunjan has asked, how important is vaccination to prevent breast cancer or other cancers? Age at which, unfortunately, we do not have a vaccine for breast cancer. Only early detection and cancer screening protocols can save you from the dreaded effects of breast cancer. We have vaccines available for prostate cancer and cervical cancer. For women, we have cervical cancers, and we have two of them available, Gardasil and Cervarix. So these vaccines are invariably recommended for ladies who are not sexually active and between the age of 13 and 26. Ashutosh Mishra has asked a question: lumps in both the breast due to high prolactin levels. Oh, see, these are galactoseals. When you have a high prolactin levels, the secretion of milk from the ducts is too high, and if the drainage is not proper, and the milk gets collected in the breast system, so they form galactoseals, which are milk lumps. So they can be drained, and they are not a risk factor for developing breast cancer. I have seen many women using padded upper inners. Will this be one of the causes for breast cancer? See, this topic was a lot in debate during the initial years when the trials for breast cancers were happening. But unfortunately, we do not have validated data that any kind of braziers or any kind of an upper inners that if you use are a risk factor for breast cancer. Does breast cancer grow? Yes, breast cancer, and especially in younger women, the breast cancer grows fast. Does mental health has anything to do to aggravate or see? Mental health is basically not only for breast cancer, but mental health is the key to development of all the diseases. 99% of the diseases, except living well, is all your mental health. If you are relaxed, if your mental health is good, and you are in a euphoric state, so things will go fine. So mental health does play important roles in the majority of the diseases, including cancer, and not only in the treating cancer, but to recoup or rehabilitate from the post-treatment effects of cancer. Your mental health plays a very important role. So that is where we need to pay a lot of stress. What is the last stage of cancer? That is stage 4. And stage 4 is when your cancer is spread to outside the organ of origin. Thank you very much. And I think so. And I thank all of you for a very patient listening. I hope it was informative. And if I could save even one life through this media, my job is done. Thank you so much.